The Endo Resto Course, as we have, as the caption says as well, rooted in Britain, designed for India.
That's a very fascinating tagline.
Let's get into teaching separate instruments or retreatments, and that tickles everyone's fancy, right? It took me about 4 years to learn it as well. How the fuck can I teach it in a day? It's a bit difficult, but it can sell. But it's not about the selling. We want to teach the basics at a very good level. You're only as good as your reviews. And if you don't review your patients, in that case, you're the best. And if you don't, you live in oblivion and you're like, oh, Jesus Christ, no patient will ever come back in pain. I'm the bloody best.
It's only when you follow up, will you realize or know what the outcome was.
Pretty much. And you know, like dentistry is really forgiving.
Immediately bombard you with, like, sir, apne ye kiya. Like, they ask you.
First of all, the sir thing I don't get, man. Like, I always really prefer someone just call me by my first name. I've not been knighted by the king or the queen, man.
Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast.
Our guest for today is Dr. Shaurya Srivastava. He's completed his MClinDent in Endodontics from King's College London. He's a member in Endodontics at the Royal College of Surgeons, Edinburgh, and is a certified specialist member of the European Society of Endodontology. He's also the director and co-founder of the Endo Resto Course with Ammar Hourani, aka the Endo Guys.
The audio podcast is available on Spotify and Anchor. The links to that are in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode.
So Dr. Shaurya, what's Endo Resto Course?
So the Endo Resto Course, as we have, as the caption says as well, rooted in Britain, designed for India. So it's as the name says it's an endo restorative course that we try to bring into India. All the educators on the program are from the UK, from very good institutes as well. And the whole idea behind it was about how a general practitioner sees a case through in their daily life. You know, when you start the endo, it doesn't just end at the endo. You have to go to the restorative part as well. Right. But it's not just that. It's about using the right principles. The course is a very evidence-based program. All the guidelines by the European Society of Endodontology as well. So, and yeah, the educators have the same mindset as well, So, as I always say, it's minimally invasive, preservative, and sensible dentistry.
Okay.
So that's literally what the endo restorative course is. That, it's very easy to teach fancy, or not teach, rather, show fancy, but it's very difficult to teach. So we want to keep it simple, but we want to teach the right principles at the highest standards possible.
Right.
So, for example, when a patient comes in for the endo, what is your restorability assessment, which people lack, people don't really follow much.
Right.
The principles of diagnosis, the misconceptions of diagnosis. In endodontics, treatments are very few, but diagnosis is many.
Yeah.
And diagnosis is the key.
Yeah.
Because every diagnosis has a prognosis and an outcome, even though the treatment might not change. So we want to teach the fundamentals of that, your different mechanisms of how you treat the endo from start to finish as well, including your warm vertical condensation of obturation or your calcium silicate sealers, and people love calling them bioceramics. That, then going to fiber post and cores as well as going to the whole resto aspect of it. We very often just go in for crowns, but why? Why take away so much enamel when we can go in for like onlays or overlays? So keeping it minimal, as well as the use of magnification for all these things. How much of preservation you can have with a microscope or with loupes, for example, which will increase the survival of these teeth too. So we want to teach all of that, the introduction of digital workflow as well, analog versus digital. Why is one probably a bit better than the other? Of course, that's not my forte. We have the prosthodontists on board for that. So our team generally comprises of everybody who's trained in the UK, members of their respective specialty with the Royal College of Surgeons of Edinburgh as well. So yeah, we had a faltering start in the beginning.
So that's the tagline, because that's a very fascinating tagline, rooted in Britain and designed for India.
Yeah, so as I said, like it's pretty much to do with what we have been trained in.
Understood.
But bringing that to India. And as I said, it's all about the mentality of teaching and the kind of teaching, of how one can sit down with somebody and help them grow. It's, at the end of the day, you can't change the world's perception, right? It's all about changing one mind at a time. And as long as you can do that, and if you care and fancy what you do, then it's a fucking win, isn't it? So it's about that, that we as a group of educators are not there for the commercial aspect. It's actually for the love of teaching, because we really enjoy it. And when you get somebody give you a shout, be like, oh, I did this today, and they enjoyed doing it because they understood it. It's not mechanical, it's biological working, and increasing the confidence too. So it's pretty much that, a different mindset, different outlook, about teaching simple rather than showing fancy.
Right.
It's very easy to be like, okay, do you know what? Let's get into teaching separate instruments or retreatments, and that tickles everyone's fancy, right? It took me about 4 years to learn it as well. How the fuck can I teach it in a day? It's a bit difficult,
right?
But it can sell. But it's not about the selling. We want to teach the basics at a very good level. So that's the Endo Resto Course. That's what we really want to do. And we had a faltering start in the beginning, but a faltering start is actually more about learning from those mistakes that you've made, because it's a different market. So yeah, it's coming back again. We have a meeting planned on Saturday.
How do you differentiate, or how does the course gets differentiated from other endo programs or other Endo Resto programs in India?
It's to do with teaching different principles.
Okay.
As I said, treatments don't change that much.
The way, the outlook towards the...
Exactly. The outlook towards every case that you approach.
Okay.
As I said, oh, there's a tooth over there, there's a lesion. Oh, fair enough. That needs a root canal treatment. But why does it need a root canal treatment? Understand the biology behind it. Understand the outcome. An irreversible pulpitis, a necrotic, partially necrotic tooth, or a tooth with apical periodontitis, they all require a root canal treatment.
Right.
But why is one going to have a different outcome than another? So understanding that's diagnosis, right? And going back to the misconceptions of diagnosis, that I've seen this so very often. Every tooth that has a lesion, people want to treat that. But that's not the case. Do your sensibility testing. We want to teach you that less is more. That just because a tooth with a lesion encapsulating 4 teeth does not necessarily mean that 4 teeth need endo. Maybe just coming from one, right? So yeah, it's pretty much that we want to teach you the basics at a very good level, and help you grow from that. And it does not just end there. We want to be associated with you guys, or you all be associated with us, whoever the students are. When you have a difficulty, we are always there to help. And the Endo Resto Course is just a small thing that we're starting. If that catches on, and if we can deliver the quality we want to, we can make it a bit bigger, but it's small things at a time.
So like an actual follow-up of the students who attend your program.
Exactly.
Like you mentioned sometime back to me about, following up cases, how important that is. So is that also going to be emphasized in the program?
Exactly. Like as I said, one of my social media posts that I put up on my Endo Resto page is that, it's about the reviewing and the importance of reviews, right? And if you don't review your patient, you're the best. And I don't remember what the statement said actually. But yeah, it's pretty much that it's not about the mentality of, thinking that, a patient didn't come back, so they must be all right. This is a very volatile market. They've probably gone somewhere else.
Right.
And somebody else looking at failures of treatment. I rather see my own failures and explain to the patient beforehand as well what the prognosis is, rather than someone else see mine, right? Because the line was, you're only as good as your reviews, and if you don't review your patients, in that case you're the best.
Yeah.
Right. So, and I work in a referral setup, more so than someone walking in and I see them firsthand. So I do mainly retreatment work. It's like 90% of my teeth that I treat is all retreatments. And the other dentist whose endo has probably failed has no idea that this patient has gone somewhere else.
Yeah.
Yeah. If you think about it.
Yeah. Makes sense. Yeah.
So yeah, it's pretty much that, right? It's about the importance of reviews, because it's not about failing in endo. You can provide the best level of work, but you can still have a failure.
Right.
That is science, right? That is unfortunately medicine or dentistry.
Right.
That everything has a success and a failure rate. But what you could have done better, or how you now take it on further to get the best possible outcome. So it's very important. Reviews are very, very important. And I particularly emphasize on that in day-to-day life, because as I said, you're only as good as your reviews.
Right.
And if you don't, you live in oblivion, and you're like, oh, Jesus Christ, no patient will ever come back in pain. I'm the bloody best.
Yeah.
And that goes to a very controversial question statement that I always say is as well, right? That if in a room of 100 people, and you ask those 100 people who's the best dentist, 90 of them will say that their dentist is the best. But who's the best? We don't know who's the best, right? And you cannot have 90 people be the best.
True.
Right? So I think it's all about perspective, and that's very important, that we need to emphasize on even when we're teaching, because we talk about these fancy products in dentistry, calcium silicate sealers, warm vertical condensation, obturation, or just example's sake, taking out instruments. But yeah, you've done that, but what is the outcome of it? What is the deed that you've done? Is it actually fruitful to the patient or not? You won't know unless you don't follow it up, right? So
It's like taking the ignorance is bliss to the next level.
Exactly.
It's only when you follow up will you realize or know what the outcome was.
Pretty much, and like dentistry is really forgiving.
That's basically a major part of your course, like doing follow-ups.
Yeah, it is. You can't teach it. You have to emphasize on it.
No, but you have been exposed to such a high level of dentistry where you have been taught that, and there are people out there who have never been told to follow up. So it may not be their fault, but once they get exposed to such a side of dentistry, it helps.
Yeah, I think it also then makes you grow as a clinician as well, right?
Right.
I'm very young in my endo days at this point. Still so much to learn, still so much that I'm figuring it out and, picking up on day-to-day life when I treat a patient.
Right.
But the principles don't change. And I want to follow these up, because I will only know how good I am and the quality I can provide.
Right.
Based on my follow-ups. Everything is not Instagram, right? I can put up the sickest case on Instagram, be it picture perfect. But when that fails, they need to see that, even good cases can fail.
Right.
So it's important. You can change that mindset a little bit by just emphasizing on it. But eventually it's your take home, right?
Yeah, and
what you fancy.
Showcasing your failure is a very underrated thing which people are afraid to do.
Yeah, so I had this, about a year back, I had a sodium hypochlorite accident. Okay. And I used rubber dam, my side bented needles, everything pre-measured, all of it. And of course, at that moment, when you do realize it's a hypo accident, everything stops, right? You shit yourself.
Right.
Because even though how to manage it, and some people might not know how to manage it. I've been fortunate enough to know the management of it and to be able to detect it really quickly.
Right.
Okay, but even in that moment to relay to the patient about all this, it's difficult, because you don't know how the patient is going to react as well. And it's not about saving yourself, but it's also about, making them understand and making them comfortable even after an accident. Now, when that happened to me, yes, I managed the patient, and she was comfortable as well. But I put that up on Instagram. I put up that I had a failure, a hypo accident, and wrote my experience, and also posted something from one of the books about how to manage it.
Right.
And a lot of people actually asked me that, oh, why would you put this up? Why would you put this up? And I was like, because, it can happen to anyone.
Right.
Someone might know how to deal with it, but someone might not. You might just mistake that pain for some extrusion or something of say debris, just example's sake, a general dentist, for example, and does not know it's a hypo accident, but you can learn from someone else's mistakes, right? So I would not say that it was a mistake, it was an accident. It was something that happened.
Right.
And I think it's important to talk about it even on a public platform, because nobody is picture perfect in terms of that, right? I learned from that, learned better management of it as well. But posting it does not, I think, it does not cast any shadows on anybody. It's about someone can pick up something, someone can learn something about it. Like I posted a failure, I think last year, and I was sitting with my Instagram and just, reading out loud. My dad looked at me and he's like, why are you saying failure alert? I said, because my case failed. He's like, oh, why would you put that up? I said, because everything can fail. Everything can fail, right? So he's like, no, but people should not know that. I said, no, of course people should know it. Everything is like plausible to fail at some point of time, and there are reasons why it can fail. So why not put it up? So it's that thing, about how open people would want you to be, or how open do you think you should be.
So how was the response to it? The overall response
to the hypo or
to the hypo accident, and which you shared on.
So the hypo accident was, the endo community that we have, the worldwide community, is a very supportive community. You learn a lot from them if you fancy learning from them. So it was very supportive. A lot of people also messaged about, you posted this, a great learning curve. So it was all in all a great response, because it is something that you should talk about.
Right.
It is something that can happen to anybody. So if it happened to me, talk about it, and someone can learn something from it, right?
True.
So yeah, that was a response. It was a very supportive response. People really appreciated the fact that someone will come out and do this.
Right.
But yeah, my whole thing was about teaching from it. I'd always, this one thing that I keep on talking about is post to educate. It's about posting something that someone can pick something up from. And it's the same way that there are so many great educators on Instagram that I pick up a lot of little tips and tricks from here and there as well. So it's all about posting to educate.
Yeah, and the point is, if you put even small amount of detail or information which is super useful for people out there, they immediately bombard you with, sir, apne ye kiya, they ask you.
First of all, the sir thing I don't get, man. I always really prefer someone just call me by my first name.
Okay. So you don't like...
No, I've not been knighted by the king or the queen, man, to be called sir. I always say that. I don't like this hierarchy thing that, oh, sir this, sir that, or whatever. We are all colleagues at the end of the day. Call me by my first name, I will respond the same way. Thank you, fine, is respectful, whatever. But I just prefer that, I think by taking out these labels, you become a little less formal to have a better conversation. It's this small thing just to break the barrier in normal conversation. So even when it's a young student or something, where I've gone to teach and they call me something, it doesn't matter. Right. Just call me Shaurya and just stop being formal. We'll have a conversation like I'm your colleague. We both are dentists. So yeah, just break it away.
It's been ingrained into our system, and it's been hammered, since day one. It's very difficult to, get rid of.
No, fair enough. So I of course was very much this is how our training has been, and it is everywhere in India as well. But I faced, so initially when I just got into my specialist training, I had the same habit, everybody sir.
So you used to call sir in back.
Yeah, and I just people would just look at me weirdly about go on a first name basis, and these are people who are bloody legends, right? Some of them are way senior as well, way older, but I don't think that by just calling them that it's that respect that just automatically generates. You can respect them for what they are and call them by their first name. So that's something that I learned, and I think that psychologically it helps a little bit in breaking that mentality of formality, where you treat one another as a colleague as well. Of course, they're your teachers, they're educators, but that doesn't change the impact and outcome of how it generates as a relationship of a student and someone you learn from.
it's like a vicious cycle, and someone has to break the wheel. So it's fair point. Like, you are taking the initiative of
I'm just
normalizing
trying,
it.
exactly, man. Like I just don't fancy this, you know, the tagging and the naming of, you know, in that sense. Like, it's like when you go for a conference, someone comes in and introduces themselves as, oh, I'm Doctor This, or when you introduce yourself to someone at a conference, like, I'm Doctor This. But why? We all know you're a doctor. We all know you're a dentist, right? We all are dentists over here. So I mean, it's just about breaking the chain. Just take away the formality a little bit. I prefer much more casual.
Right.
You've known me since my undergrad days.
Right.
That's one thing that does not change. I think I've become a bit more informal than I was before as well.
Makes sense. So, speaking about mistakes, what are the common mistakes which you see clinicians doing, which are avoidable according to you?
I mean, there's going to the basics of it, basics of diagnosis. I think there's a lack of ability for good diagnosis and treatment planning based on that. That being one. The other thing that I would probably say as a mistake again is not mistake, but inadequacy is about, you know, how much you take in times of a consult with the patient as well, because it's very, like, I see a lot of, like, you know, I've seen over the course of time 15-minute short consults, 10-minute consults, whereas, you know, you need to give time to the patients. So it's not, I wouldn't say it's a mistake, but it's something that can change, because a patient, when they come and you walk in, even if it's for a single tooth, I would probably spend about 30 minutes with you, just examining, checking everything out. Then fine, we go to take a periapical radiograph, take a CBCT, all of that, and then explain to the patient. You have to educate the patient about what they're getting into. Patients these days are very smart, right? They will read, they will have a look at probably other options, alternatives. But it's all about how you educate them in your consult. And if you can sell your treatment plan with conviction and where they are on the same page, knowing the pros, the cons, the benefits, the outcome potentials, spend time with them, educate them, 60% of your treatment is complete. Because as I said, everything fails. And even if that fails, you've warned the patient about it. So I think diagnosis, your treatment planning basics as well as, you know, talking to the patient and consulting them. Then in endo, of course, it's the rubber dam. It's, as I always say, that it's not just a tool, it's science. It differentiates a mechanical worker from a biological one.
Right.
The trend has caught on these days because of Instagram, but it's not that, right? It's not about the fear of being called out while you're using it, but it's science. It's just bloody science.
Right.
So yeah, I think, I mean, this is just at the top of my head. This is a list that can go on. But
like people are not using rubber dam for the patient or for themselves. They're using it because they don't want to be called out.
Exactly. And you know, like, it's like, why do we use a rubber dam? There's the science reason and the medical legal aspect of it as well. So whenever I do talks on the rubber dam, I always tell the person who I'm doing a talk for that this is not going to be a presentation about how to put one on. There are 100 courses. I'm not teaching you that. I'm teaching you why to use it.
Right.
And there's this rationale that I developed, which is when you're amongst a cohort of students or dentists, it's questions that are very simple. Some are tricky, where I ask the audience and they know the answers. And that is kind of to reinforce why you use a rubber dam, because you know the answers, now put it into practice. Like simple thing, right? We're doing an endo to remove bacteria from the canal, right? Because it is infected. But where did that infection come from? From the bacteria in your saliva, right? Now, if you are doing something and introducing the cause of failure again, you will never get a dry space with the cotton pellets. It's just impossible. You're introducing bacteria back into the canal. Now, people will say anecdotal evidence, oh, but I've seen these treatments work and I've seen lesions heal. Even I've seen lesions heal with a rubber dam. But how often do you review your patients? You can have late failures in endo, right? Endo, like dentistry, can be very forgiving. It's basically you can take away the patient's complaint, but not actually deal with the problem, and you're still God, right? So it's pretty much that I can get you out of pain. I've not used a rubber dam, extirpated, whatever, probably done a faulty endo, and the patient's happy, and that tooth might survive for 20 years as well. Now, there's a difference between survival and success, right? Success is about biologically sound in your mouth, clinically and radiographically absolutely fine, and the tooth is functional. Okay, so all parameters checked. Where survival is, irrespective of the biological aspect of it, the tooth has been retained in the dental arch. So it really depends on what you fancy working towards, success or survival. So yeah, like going back to the thing about the rubber dam as well, is that, we talk, there's a science part of it where you can talk through infection, you can talk through restorative, you can talk through your intercanal medicaments and the solubility dissolving, all that, as well as going into the fact of the medical legal aspects like hypochlorite accident. It can happen.
Forget that,
Right? And like that day I saw this thing, I think I put up on Instagram. I was cleaning out this place, and there was a bottle of mint flavored sodium hypochlorite. And it says for dental use only. And I was like, Jesus Christ, like, is it just that in case of a spill, let's make it pleasurable? Like, is that the mentality about it? So yeah, talking about the medical legal aspects, it's not often that a patient will swallow a file. But what if they do?
Yeah.
What if they do? That what if moment is always there. So
And
yeah,
it can happen to anyone at any point of time.
Sorry?
It can happen to anyone at any point of time.
100%. It can happen to anybody. It can happen to the best clinician in the world, right? And we always keep on talking about, everyone wants to learn the highest standards of treatment, etc. It starts from the bare basics. People are selling files, talking about, this file is better than that file. It doesn't matter. The files do the same bloody thing. It's about still disinfection, right? At the end of it, it's about sterility.
Yeah.
And it starts with enhancing your practice by using a rubber dam. And if you don't understand the use of it, or you are reluctant, as I've seen and had conversations with people who are reluctant about it and very headstrong, I'm sorry, you don't understand science. It's very simple.
Right. And makes sense. And once you start using it, you can't go back.
Yeah, because, of course, there's the scientific benefit of it. The other benefit is a good, clear field of view as well.
Right.
The other benefit is that, there's this misconception that patients find it uncomfortable. I've put a rubber dam on probably on 1,000 patients. I've had complaints from 3. Okay. But at some level, even for those 3 patients, it is a non-negotiable. It's like if you want to do an endo, a patient has a fear of needles, are you going to not give an anesthetic? It's a non-negotiable, right? And patients actually do not mind it. Most of the patients say that, okay, we are comfortable. That comes in the education part of it. Because I tell the patient, I'm going to now be putting a rubber sheet across the face. Now they'll be like, oh, what is this? Because they ask me that. And I tell them what it is and what the benefits are. And it's a non-negotiable. If it's like, as Arnaldo Castellucci says, is that if you can't put a rubber dam on a tooth, you either find a way or you extract. That's pretty much it. And then another one I picked up from Instagram, which is actually quite funny, is like doing a root canal treatment without a rubber dam is like spitting in the tooth. It makes sense, right? Everything was bloody disgusting. So yeah, I think it's the basics are where it lies, the importance of everything you do. And yeah, patients, they don't mind it. They don't, and if they mind it, either convince them that this is what it is, or go to someone else. But you got to stick to your standards. You really have to stick to your standards.
Absolutely.
About what you do. You can't compromise on certain basics of you're a medical professional at the end of the day. If a patient doesn't like it, you can't compromise on your standards.
True. So you did your MClinDent from King's College. How was that experience? And that's not something which a lot of people can boast about. And
I mean, it's not about boasting about it. Yes, I've been lucky to be there, lucky to have experienced that. And talking about my experience, it was bloody difficult.
Difficult?
It was bloody difficult. It was a mountain to climb. It was very far from easy or anything like that. And of course, it really builds you up as a person. The standards are very, very high. The mentality that you go into a specialist training, thinking, okay, you know what, like we've always been handheld and spoon fed and we're going to be learning it from scratch or whatever. It's none of that.
Yeah.
You're already expected to be at a very good level prior to getting into your...
Supposed to know your basics.
Yeah, like it's like basically if you are doing the endo program, right? No one's going to come and teach you how to do an endo. Your first patient, like my first patient on the job, was a retreatment of a lower central incisor with 2 canals in the morning, and afternoon was an exploratory surgery for a vertical root fracture. And you're just sitting there like, bloody hell. I barely even knew that the lower central incisors have 2 canals. So yeah, I mean, it's that. It was very difficult. The standards are very elevated. You're learning amongst the top of the top guys. Even your colleagues. Your colleagues also, they have vast amounts of experience. And if they're not legends already in the endo field, they're on their way there. Like they are bloody brilliant. So you learn so much from even your colleagues, apart from the people you work with, and it is daunting. It's intimidating. And you know us as when we finish undergrad, what are our basics? It's absolutely like, what can I say? Fuck all, pretty much.
Shambolic.
Exactly. It's an abomination. And then you go straight up like, yeah, I did 2 years work ex. I did courses here and there thinking that, okay, do you know what? Now I'm ready for this. But not...
Okay, so before joining King's, you had...
Yes. Yeah. So when I finished my undergrad, I worked at a hospital, at Ambani Hospital for a bit. Then I said, okay, you know what? I need to do some, I need to learn some endo because this is the bare basics. So I went to Bangalore for 4 months to learn endo. I never did a single endo during my undergrad, which is not shocking actually, given how I was in undergrad. So I went to Bangalore for a very good course. Learned fair enough good basics about it. Did some clinical work too. Following which, came back and joined the fellowship at Diva Patil with Dr. Vivek Hegde, which was a part-time fellowship, 1 year, where I was working on the side as well. And yeah, that was a very good program. He's a great educator, like utmost respect in terms of the treatment that he provides, as well as his mentality for teaching and the time that he gives you as an educator. It's very difficult to get that humility from someone who is considered such a big legend in India. So that was a very good course that I did with him. And then I thought, okay, do you know what? Now I'm ready. Now I'm ready to go for specialist training. Fuck's sake, I was not ready.
And that was still not enough.
It was not enough because, we're learning, again, when we go on for programs, you start learning a bit more enhanced stuff. Whereas it's all about the basics. It's all about, over there you learn diagnosis. You learn the basic principles of dentistry. So I had to pretty much unlearn everything and relearn everything. And as I said, it's not spoon-fed, it's not handheld. You have to do it yourself.
Did you ever feel like giving up?
Mate, I wanted to quit like about 3-4 times. I was like, I can't keep up with this. This is very difficult because you're not only just doing such complicated and difficult treatments day in, day out. You also have to be able to deliver in terms of conversation with your colleagues, with what's expected from your consultants as well. And one thing I would definitely want to highlight is that, there is the amazing thing over there was the constructive criticism that you get. Nobody puts you down, but they show you and they will not teach you that this is what you need to do. No, that's for you to figure out. But they will guide you. They will tell you what probably you need to work at a little bit more. Put you in that direction. It's no hand holding, but it's incredible. Like, constructive criticism is really important, which we were never used to, right? It's more about yelling at the person or whatever. But in this case, there was none of that. It's only and only about, okay, you made a mistake. You got to learn from it now.
Right.
How are you going to improve? I started going to undergrad clinics as well because my basics were really, really poor. And I told you a bit earlier too that, at the end of my first year, they wanted to send me back for 1 year to work on myself a little bit more. But that's the point where you realize, okay, do you know what? This is not an option. You've got the opportunity to be at the best dental school in the world. to be learning amongst people you can only dream of, this is not an opportunity to let go. So you just got to put in those extra hours all by yourself and just go for it. So for the first 1 year, it's like, you're pulling yourself out of the deep end of the well. The second year is like, okay, now I'm starting to understand it. Now I understand what I'm doing. And that's because of self-learning as well. Not taking away the quality of learning that you get, the kind of critical thinking that you develop over the course of time. But yeah, it wasn't easy, man. It wasn't easy, but it's the atmosphere. It's the people you work with, you train under, that, you just strive that you want to be that, you want to deliver, and it's not an option. It's not an option, but not to deliver.
Right. So was that the changing point, like the life-changing point where you decided, like, you have to put a best foot forward?
All of undergrad, if you ask anybody who knows me, they'll be like, this guy's not meant for dentistry. And honestly, if you ask me also, I fucking was like, you know what, man, like, this is not for me. I thought of different avenues, different things, all of it. And even when I was there, as I said, I wanted to quit 2-3 years because it was very difficult. But I think going back to the atmosphere of where you are, it's once you start embracing it, and once you start understanding that you don't really get this opportunity again, you just have to turn over. And I think once I started understanding it, I started loving it. And now that's my life. Like, when I'm even chilling or whatever, probably I might be reading a paper and my mom looks at me, she's like, what the hell is wrong with you? Like, you're teaching, you're doing this, you're doing that. And I'm like, yeah, because now I understand it. I love it. It's a switch just flicked over time. And again, that's a lot of credit goes to the faculty at King's, the people you train with, because they're all inspiration, you learn so much from them. And at the end of it, you're like, Jesus Christ, man, like, if you got to do whatever you want to do, you got to put in that effort the way that they have. And you got to learn, you're learning from the best. So if that switch doesn't flick at that moment, you're just like, it's never going to switch.
So it was always there. It just needed, a moment of
I needed the right environment, I think. I needed the right people to guide me to basically change that. And at the same time, I always joke about, I think that Kings needed me as well, only because just to test the limits of how much to push a person to basically get them to the right level. But yeah, it was that.
A lot of us see the positives about studying in UK, studying in King's College, but I'm sure there must be downsides. There must be moments which you are not the nice ones, which not a lot of people see that. People always see the brighter side, but there are darker times. So something about that which you can share as a student in King's.
What I would say, it's not about, there was the dark side, there was no dark side. The downside also was basically how inadequate it was, that feeling in terms of what the level was and where I was at initially. That was like, you keep putting yourself in that situation, and you are in that situation where it's a mountain to climb. You know that you're not at that level, and it can break you. So yeah, that was the one thing that that I would say was difficult. But the other thing probably was that, you don't, it's a very different program in terms of how it is. It's not your regular university life where you go and probably are going drinking, smashing tequila on a Tuesday night and just miss work the next day, right? It's not that. It's a very professional based program. So it's a 9 to 5, Monday to Friday. So yeah, the way your relation is with, like, meeting newer people, it's like you have to go that extended mile. It can be very, very lonely, even though you're a very social person. So yeah, it's even that, you have your colleagues at work as well. And it's not like in India we used to, like, okay, every night probably meet somebody or the other, because it's just common, it's normal. It's not normal there. It's like Monday to Friday, you're rigid. You're like, this is my life, because beyond that, it's your cooking, you're doing your laundry, you're cleaning, stuff, doing admin work at the hospital, you're working out, all of it. So you don't actually have time either, right? So yeah, that is a bit challenging.
So what helped you in those times, in those, say, like tough times?
So, I mean, of course, there's the element of being able to go to watch Arsenal on the weekend. Of course, I love the pub, so drink it away because that's always fun. CrossFit. So, in my first year, I was staying with my in a student accommodation where I had people from different courses who had a much more chilled kind of schedule than I did.
Right.
So yeah, I made great ton of friends there, but then after 1 year they left, and once they left, you're like, oh fuck, what do I do now? Of course, I have a cousin of mine in the UK as well, and I made some really good friends during my course who have now become very, very close over time. But I was at that time, and at that time you're like, fuck, now what do I do? So I knew that one place where I will meet friends and I have a blast is CrossFit, because I love CrossFit. So I joined there, and voila, within like a month and a half, had a crew, and those guys till date are like my best friends, like very, very close friends. So yeah, it was
it's amazing. Yeah.
That really helped. And then over the time, you also build very good relation with your colleagues too. So that becomes a bit more fun. It's always, I mean, it's a lot of academic talk as well, but it's fun,
Right.
it makes you turn your brain a little bit as well.
But CrossFit is something which you carried from India, right? Because way back in undergrad days, you were one of those guys, those CrossFit guys in college.
Yeah, so I joined CrossFit, I think 2012. I loved it. It was great. It was different at that time. It was very new. I saw immense results as well. So, and I just loved it. I love training. So following that, then I got the chance to do it in London as well, which was again a very great level of CrossFit. My coaches there were bloody phenomenal. And that made me love it even more, fall in love with it all over again.
Right.
Testing my boundaries, pushing myself, and I'm competitive and I like that. So yeah, it was great, man. It was absolutely unbelievable, that experience.
Amazing. So coming back to King's College, a lot of people might be messaging you or asking you about, should they join this program? How do you go to UK? So what would your advice be for them, students who want to go to the UK?
First things first, I would say is that, it's bloody brilliant. If you get the chance, go, because it doesn't only change your the way you are as a clinician, but it develops you as a human being. It is incredible, the experience. I mean, if I had a chance, I'd go back in a heartbeat.
It's totally worth it.
Oh, mate, it's unbelievable. As I said, it is. You've known me before, and you know me probably now, right? Yeah. And I see the difference in myself. If I have to look back what I was prior, I would not recognize myself. So do it if you have the choice. But what I would also say is that don't go with the thought process that we have in India, that as soon as we finish our undergrad, we want to go on to the next step and do a master's. 2 years of work after also was not enough for me, right? If you want to get the best out of the program, do more before you go there. Work a little bit more, take up more courses, learn from better or good mentors who can help you. And because when you go there, then you have to, as I said, you're not on your own, but you're also on your own, right? There's a level of independence that you're given at the start, which might also be taken away from you later. So yeah, I would say work more, because the more you know, the more you get out of that course.
Right.
And because it's MClinDent and then your membership exam for your specialty in the other role called surgeons. It's not only about the specialty that you do. It is very much to do with all things dentistry. So when you're doing endo, you are invariably a member of the restorative dental faculty. Okay, restorative dentistry. So restorative dentistry comprises of endo, perio, pros. Now, when you go to endo, you're not just doing endo. You have
both.
You have to have a good sound master's knowledge of perio and pros. Okay. Because perio can impact your endo, pros can impact your endo, and vice versa. So it was not only learning endo, it was also learning learning your 2 other specialties as well as more general dentistry too.
Right.
And it's not as, okay, take a textbook, rote learn this and put it there. No, it's all based on evidence. It's only and only good papers. So yeah, you need to understand that. And that was something that I would say that, that probably had I gone a little later, I would have learned more.
Okay.
I would have probably known more. So yeah, I think if you want to get the best out of the program, don't rush into it, because it's a life-changing opportunity. It's bloody brilliant, but it can be even more brilliant if you know more.
Because we always have that notion, you complete your undergrad and immediately then very next year you need to join your masters. But it's not like that. You need to, especially for people who want to go to the UK. And they need to know the periodontium, the occlusion and everything, just not...
Exactly. And it makes sense, right? Because it's a whole holistic picture that goes into going back into diagnosis. Treatment might be done by someone else, but you as a specialist should be able to diagnose it. So yeah, I would say that, it was the most fondest time of my life, 100%. I only look back fondly, but the regret is that I wish I knew more before I joined, because I could have probably picked up more and been probably a better clinician, lesser of a learning curve maybe. So yeah, that's what I would say. No more to go there, because it's just brilliant. It's brilliant.
So why endo? Why did you choose to do MClinDent in endo?
So endo is one of my weakest subjects in dentistry, as actually all were very weak subjects. but when I started working post my undergrad, I realized that I don't know fuck all about endo. I need to enhance this a little bit more. Then the more I started doing those courses, etc., started learning about it, I said, okay, this has become a bit stronger. So, you know what? Why not? Why not go and do or apply for training in the same thing? So that's how it happened.
Was that your actual mindset, that you're weak at this, let's work on that?
That was one of my mindsets. I was also exploring other alternatives. So I was looking at forensic dentistry as well. Did a couple of courses on that. Went all the way to Las Vegas for a conference over there on forensic odontology, only to learn that I don't want to fucking do this. So till date, my dad keeps on saying that, oh, you went there to party, not for the course. I was like, do you know what? I saved myself a world of pain by just going there to not take this particular subject. So that was one thing that I fancied at one point.
I find the trip quite fruitful, because you realize that this is not something which you should be doing.
Exactly.
It taught you something.
So, but my dad was sponsoring it, right? So his mind is a little different.
I think you should sponsor one trip for him later in life.
To Vegas.
Anywhere, wherever he wants to.
So yeah, forensic was something that I was keen on, and realized I didn't like it. Because then you're just waiting for a natural calamity, man. You're like, oh fuck, when is the cyclone going to come? Because that's what you're looking at. In India, the applications are different. You're looking at child marriage or child labor, etc. And you're just like, fuck's sake, that's rather depressing, man.
Yeah.
That's probably not something I want to do
for
entirety.
With the police, you have to deal with the courts and everyone.
Exactly. So it's fascinating. Good. You understand about it. But it's not for me.
What's the main difference you find between... I know there's a lot of difference, but one major difference between when you were in BDS and when you were doing MClinDent. What was one major difference between the two?
In what sense?
For example, dentistry-wise, the approach, was it the approach towards dentistry? Because you spent almost close to 5 to 6 years in BDS, almost 3 years in the UK. So the approach towards dentistry was different.
It's
the
very
clinical
different.
aspect, or what, according to you, what was the main difference?
I think it's the modality of teaching, and the quality as well. I think these are the two very, very big differences, and your critical thinking as well. As I said, it's the fact that there's no hand holding you have to do it yourself. You will be guided, but no one's going to come and hold your hand and be like, you have to do this. No. And another thing that is really amazing, that was very different for me, was that, as I said, it's very evidence-based in terms of what you're learning. So if I am working on a patient and I'm doing a treatment that my consultant might not agree with me on, okay, but I tell them that there's the evidence showing this, and it's a valid paper. It might not be something that he follows or she follows, but it is an article that is well accepted as well.
Yeah.
So your opinion is respected. Now, if that fails, it's not your fault that it failed.
Right.
You probably have understood why it's failed, and now you have to do something beyond to rectify it. So going back to it is constructive criticism, where I think that again comes in the mentality and the teaching as well. Your opinion is valid if it is acceptable.
Right.
So just because someone is, whoever they may be, might not accept what you want to do, or might think that there is a better way, does not mean that you are wrong.
Yeah, you're not looking for scapegoats.
Exactly.
Out there. Yeah.
Exactly. So that's another thing, that I think getting the free hand and independence, and I think that's one thing you learn as well, your decision making skills, as well as your independence, because as I said, you're pretty much allowed to do what you want. You of course have everybody around you to help you whenever you fancy, but they teach you independence without even you knowing it, that you're ready for private practice, you're ready for that.
You're not afraid to speak out, because that's one thing which if anyone will ask me, because back in our undergrad days, we're afraid to ask a question. We might be shamed. It may be a very simple thing, but that's something which...
So there's no... again, when I teach now, I say the same thing, because I have a lot of connections I've made across India through Instagram. And very often people are like, oh, can I ask you a very stupid question? So there's no question that's stupid. Right? If you don't know the answer to it, it's not a stupid question. Every question is something that you can learn from. Right? I also would ask the most irrelevant and most stupid questions in my training as well. But you're never put down for that, right? Because you honestly don't know. You are either told that, okay, go read this, come up with your own rationale for it, or someone will tell you why or what, or answer your question. So there's no stupid question. I don't... I see that because I was that as well. We all were in undergrad, that you're sitting in a room of 80 people and you have probably 10 doubts running in your head, and you're like, but I don't want to ask this question. And when somebody else has the balls to actually ask that question, you're like, oh fuck yes, they've fucking done it. And you're just like stoked that answered your question. But I don't think it should be like that. And I think it also boils down to the form of education. I think it really depends on how you're treated during your training as well. So yeah, I think it's important to speak out. It's important to ask the relevant and right questions, because that's the only way you're going to learn.
Right.
A textbook might tell you this is what you're doing, but it probably might not tell you why you should do this. It might not be clinically relevant to what you fancy. So yes, and your supervisor is the person who will be able to guide you towards why, right? So yeah, I think it's to do with the system. It's pretty much the how we have been, how it's portrayed,
right,
and how it is.
I hope it changes, and it's changing. So also, especially after your undergrad days, you mentioned you did a lot of endo programs. You did a fellowship. You had a 4-month program. Did you have a chance to think about doing MDS in endo, or your focus was just to do MClinDent in endo?
My focus was to go abroad.
Okay.
I never even once it crossed my mind to do my specialist training here. That's why I took the plunge and did not do your traditional finish and start applying or whatever. I wanted to go abroad. I applied to various different universities after 2 years of doing my work ex. So yeah, I always wanted to go because, I never liked dentistry earlier. And I thought a different form of education might help. So yeah, I wanted to always go abroad. King's happened however it happened. Honestly, I don't know how the fuck it happened. I was fucking lucky because I think getting in there in the first year, they also must have thought that fucking hell, why did we accept this guy? But
I'm
yeah,
sure they're very proud of you right now.
I hope so, man. I hope so. It's a lot of self pressure. That
Like you have a target on your back. He's from Kings, Like,
I mean,
do you ever feel that in India?
I don't know what other people might think of it. I think it's the self pressure that I have for that weight that is there to carry. Some people don't really care about it or might not carry it or whatever. But I personally think that I got the opportunity to train at the best dental school in the world, in the biggest endo postgrad unit in Europe and arguably America maybe. Amongst the top of the top people.
Absolutely.
So there is that pressure that it's a self pressure that, you're associated with that. You don't want to bring that down. You don't want to bring that name down. So, it's a good thing to have because it always helps you grow a little bit more, makes you humble because if you think that you are bloody good, you also know that over there, they are bloody good. Right. So yeah, there is that self weight that is there. Other people putting a target on my back, honestly, I really don't care. That does not drive me. My drive and everything is to do with my association with Kings, and how it should be shown, in what light it should be shown, that it's a brilliant institute. Top of the top people, and that's literally what it is, that they make you who you are. So that it's a self thing. It's a very much self thing.
So we go back to your origin stories as you entered BDS.
Oh fuck.
In 2010. And so how was your BDS experience, if you can sum it up for us?
How was it? It was a whitewash. I barely attended because I didn't fancy attending. I think yeah, if
you think about it, like first year, like if you just run all the years through your mind, how was it? How do you feel about it? Thinking about now,
it's a whitewash. As I said, it's a whitewash. It's an absolute whitewash. Of course, you have to have experiences, whatever. It is whatever. It is what it is. But
it's part of you now.
Yeah, of course it is. Of course it is. It's not that it's completely erased, because that's wrong to say, right? It's very wrong to say that. But yeah, I think I could have learned more if I basically wanted to learn more, which I think at that point of time was pretty much off my head in that sense.
So why did you choose dentistry then? Like,
you want the unfiltered version or the filtered version?
I think I'll take the unfiltered, which seems more spicy. Yeah.
So we have to add the filtered as well, because that is an element as to why.
Go on, please,
So the filter, the initial thing was that, when we were choosing, do you want to do science or you want to do economics? At that time, there was the recession that had hit, I think 2008, if I want to say around then. And I saw a lot of my parents, my friends' parents and parents' friends lose their jobs, etc. And science seemed more like a safe bet, and my grandmom, granddad, from my mom's side, both doctors. My grandmom from my dad's side, doctor. I'm the reject because I'm the dentist. My Masi is also non-practicing dentist. She's more of a soccer mom. So it's like, okay, do you know what? Let's do it. Let's go into it. But the decision for dentistry was a decision I made when I was really high. So I got into medicine as well. I got into dentistry too. Now there's, again, going a little bit behind that. I did my IGCSE and then I went into HSE because I had to get back into the Indian system.
Yeah.
It was difficult. No calculators, all this shit. It was very difficult. So when we finished the 12th grade, of course there was the CET element and stuff. And I was like, okay, do you know what? There's no chance I'm passing CET at this point. I need to take a 1-year break and I need to basically study for it if I want to pursue this further. And of course, you had a private college exams as well. So I remember going for the CET exam because my parents were like, you have to bloody go give it. Okay, you have to give it. And me and my friend, I think it was a college in Ghatkopar if I'm not mistaken. Me and my friend, even he had the same thought that he's going to take a 1-year break and he wanted to do engineering. We're sitting in the car and 7 a.m, getting high as fuck. This is how to pass the time at this point because we know nothing. We know absolutely nothing. So, and you see people because other people have studied for it. There's value to it. They really care. They've dedicated 2 years of their fucking life to do this.
Right.
So they've come with their parents, doing all the religious different things, and me and him are just sitting over there. And that's when it dawned upon me, like, fucking hell, we're too high for this, man. Like, this is not going to work. So, yeah, we gave our CET just to give it. Of course, we did miserably. I think he got 111, 112. I got about 103. Whereas the cutoff, I think, was 180 or something like that. So that was expected. Studied a little bit for the DY Patil exam. Got into that. So, when I got in for medicine and dentistry, which was fucking surprising because my friend called me up saying that you passed, and I was like, nah, this is just a fucking lie. Like, don't toy with my heart. She's like, no, you got in. So eventually got in, but then they asked to make a decision, medicine or dentistry, and like this is when I used to smoke pot, and I was like, I was very high when I made the decision, and I looked at that and I was like, okay, MBBS is about 5.5, 6 years. Dentistry is 5 years. Dentistry is only head, face and neck. How much is there to study in that? Not much, right? No extra hours, none of that. Fuck it. Let's take dentistry because I'm a lazy individual. And that is predominantly how.
So you had this conversation in your head?
In my head. Like I rationalized all of it and I was like, fuck it, I'm taking dentistry, man. Like, yeah, that's what I'm doing. So I think that's why I think it's been a very different journey as for me, because I don't think initially I really cared much.
Right.
Yeah, it was a roller coaster. Absolute bloody roller coaster. Because I think my focuses at that time were elsewhere. I was chasing football and women, I think, during that point of time. So didn't really care much. I was like, okay, I'm here. I just have to do this, and that's all. As a formality thing. Mentality, mindset was a bit different,
right.
Which I'm glad it fucking changed.
Any one thing you wish you should have done more of in your undergrad days?
Studied more, attended more. Pretty much that. I think I attended so that I would not fail. That was the mindset. I think a lot of us had that mindset, right? We should attend to not fail.
Right.
Which is, I think, the very wrong mentality to have. So, yeah, I think I could have dedicated more to it at the time. Could have given it more of a chance than I probably wanted to at that point of time. So, I think also because you're very young as well, right? Your mentality is a bit fragile in that sense.
Right.
You'd rather be doing tequila and getting hammered rather than attending, for example. So, yeah, it's pretty much that. Yeah. I wish I attended more for the right reasons.
Any one incident from your undergrad days, if you can share with us?
One incident?
Which has stayed with you. Can be a funny one, can be not a funny one, but a memorable one, which you remember, you think of, suddenly, and it brings a smile to your face.
What one thing that again is non-dental related, that's the funny thing. It was the football aspect of it. That when the first year of the football tournament that was there, I think that was memorable because it really got the class together, right? It was the first trophy that we won as well, and there was that sense of unity just before we finished our internship. So it was pretty much, I think, in a month's time, it was like goodbye. But at that point of time, like, for the entire month, the kind of unity that it brought in the whole class, it was amazing, because we never saw that.
Right.
We never saw that. You know how the politics happen, in your undergrad, in your different batches, etc. But it just felt like for that 1 month, it was such a great high that people are mingling more, people are going out more together as a group. And yeah, I think that was a very good, memorable.
Yeah, and we had passionate football, boys.
Yeah.
We also had like a Man U group. We have an Arsenal group, and we also had a lot of fun playing FIFA.
Yeah.
I don't know if you remember. During my internship, we had organized a FIFA tournament.
I remember that, and I remember that we had to cut it short because the TV stopped working. Yeah. I remember that.
Like, we had 81 people from the entire. I mean, we didn't know they were so, people from all over the college.
I think it was a very cricket instilled university at the time. Football was on the rise, but they needed someone to grab it by the scruff of its neck and be like, this also exists.
Yeah, because personally, that's like one of my personal highlights of undergrad days. Like, we organized a FIFA tournament, and we had boys from, even girls, a few girls from all over the college playing FIFA on the 4th floor. So that's one.
Well, I think I got really lucky that football helped me not get ragged. I would have been a very easy target to rag. So when I just joined, I was first looking for the people who are going to be playing football. So I met Yash and Osric. They were like, yeah, we'll have training and stuff like that. Then through that, I became friends with them.
Okay.
So I think if that did not happen, there were a lot of people who would have been behind my ass for whatever reasons. But yeah, I think that's another thing to add. Like, it helped. It helped a lot.
So many memories. So we'll come to our final section, which is a rapid fire section, where we ask you 8 questions and you have to answer as fast as possible. So we'll start. Your favorite BDS posting?
Probably oral pathology, because you didn't really have to do much.
Yeah.
Actually community dentistry, because you got to get out of college as well.
Yeah. Did you guys get a chance to do those camps in different places?
When we did, I didn't go.
I'll take that. Your favorite football player?
My favorite football player? All around would be Zinedine Zidane. Because I think that...
It's a little surprising to know that, but...
I think he was just simply majestic,
Magical, yeah.
Just the way he collided with the ball, the things that he did, and the way he carried a team being a midfielder. For me, it's like, of course, I love Messi. I have my Arsenal favorites as well. But the person's videos that pop up on Instagram every now and then, I still sit and watch them more than anybody else has to be Zinedine Zidane.
Your favorite dental instrument?
Favorite? Probably is Reciproc. Blue.
Reciproc.
Yeah, it's a rotary file, reciprocating one for retreatments. I love it. Like, you don't get them in India. Very difficult to get them in India. I order them from Poland because I can't work without it.
Are there any alternatives in India or no?
You have other files, but I personally like them a lot. I really, really like them. And I've been used to them too. So yeah, I would say Reciproc Blue is what I love.
One thing you miss about London the most when you're in India, and one thing you miss about India the most when you're back in London?
What I miss about London is the pub, man. Just the part of the culture to go for the cheeky pint. Of course, being able to go for a football game, being a member of the club, going on the weekends for the games. Also my friends. I just really miss my friends. It's a very different...
The lifestyle.
Yeah, the quality of life, all of it. The ability to be able to travel on a weekend to another country. So it's a lot. I can't sum it up in one thing. There's a lot of things I might just miss, but yeah, I miss a lot about London.
And one thing about India you miss when you're in London?
Dal chawal, bro. Dal chawal. That has to be the thing. Like, whenever you come back from London for a 2-week holiday or whatever, my mum would very excitingly call saying, I'm going to make mutton for you and stuff. And mutton she makes is bloody brilliant. But I'd be like, no, I just want dal rice. She's like, what is wrong with you? I said, no, just make sure there's good tadka on it and get me some nice sabzi on the side. That's it. That's what I miss the most, about.
Sounds tempting.
Yeah.
One thing you wish to change in the dentistry scene in India?
Education.
Okay. What about education?
I think all of it. I think upgrade of what is being taught. Equipment and material is all there.
Okay.
We're not, I mean, there's everything available to us. But like if I go into a postgrad department, they have 2 microscopes for 15 people. Just an example, and they get to use it once in 10 days. It's not that more can't be procured and can't be emphasized that people use it.
Right.
So upgrade of skills, standards, educators wanting to educate, wanting to upgrade themselves, as well as people wanting to learn rather than just putting something on the wall as a certificate. Because that is another thing. It's like first thing is they ask, will we get a certificate? It's like, yeah, you will get a certificate, but that's not what the idea is about.
They're missing out on the whole point. Like, you're not doing it for the...
Yeah, you're not doing it just to put it up on the wall, right? It's pretty much that. If you want to learn, then you learn. But also, I think the education system, I think that is something... Dentistry will only change if education changes, because that changes mentality. Right now, I don't think we are there. We're still... There are people who are trying, but there are the older mentality that is just pushing them down as well. So I think education...
I'm sure things will improve and we have people like you to do that.
Oh mate, I'm not changing the world, man. I'm definitely not changing the world.
Who's your inspiration in dentistry?
I have a couple of them. I mean, they're all my colleagues and my faculty from King's. Everybody has something different that I picked up and learned from. So it's not only the people that taught me, but also the people I trained with in my batch. 1 year below, 1 year above. I think pick up different qualities from all of them would be my ideal way of developing.
Right.
And I still learn from them. I still have my mates who I will give a shout out to, be like, guys, I'm struggling on this case, or I want your opinion on it. And they're always there to help. And, I'm learning even now from them, learn a lot from them.
We want to know their names.
So I would say, the one person who took me under her wing during my training, she's like, I'm going to bring you to that level. She's Krina Patel. She's very well known on Instagram, but my God, what an educator. Philip Mitchell, as I always say that if by the end of my career, if I have 10% of his knowledge, I'm a success, because that guy's a bloody genius.
That's high praise, yeah.
Then there's Federico as well, just how brilliant he is as a clinician, and how calm he is. And at the same time, he enjoys a pint as well. Then, of course, you have Shannon Patel, diagnosis, again, mentality of keeping things simple, not overthinking it. So yeah, I'm pretty sure I'm missing, of course. And then the one person to talk about is Professor Francesco Manocci, the guy who's keeping everything together at King's. I call him my grandfather of Endo. Like, he's what I think of in terms of, that guiding arm the whole time and keeping everything under control and just brilliant. So there's, I'm probably missing on people as well. There's Elia, there's Bhavin as well. Bhavin, unfortunately, me and him I was not on his training days, but oh man, like, he's brilliant. Daniel as well, trained under him, but became more of my mate. Then I have my colleagues. These are all the people who taught me, but then I have my colleagues who I still learn from every single day. Thiago, Rahul. So yeah, I can't stop naming them.
And I'm sure they're great mentors too.
Yeah, as I said, that everybody has different ways that they have helped you in, that you just are like, what, like, you have to pick up the best from everybody a little, because you can't totally be that person, because they're pretty much original. But you can try and get little snippets of them to try and develop yourself. So yeah, the mentors are the people I look up to. I can't name one single person. And if I missed out on anybody, guys, I'm very, very sorry. But yeah, this is what at the top of my head. Everybody at King's The way they taught me, the way they helped me, the way they had patience with me, and my colleagues as well, to help me bring myself up to the level that they wanted me to be. So everybody has a role in it. So I look up to all of them. That's what I would say. That's pretty much. I know that's not the straight answer that you wanted, but that's the honest truth about it.
No, and I think you're very lucky to have so many of.
I mean, as I said, I don't know how I landed up there. It was an element of luck as well, but yeah, I tried to make the most of it, and I got lucky with everybody.
Okay.
Their role in my development, or whatever you want to call it. And I'm lucky to still have them as good friends even now. So whenever I go back, there's always an evening, a couple of pints, have a good time as well. So it's a great relation as well that I've built with them.
One high and one low point from your undergrad days.
The high is that I passed all my exams. And the low is that I got grace marks in all of my exams. So every year I got grace marks in at least one subject to make it to the 100 mark to pass the exams.
I'm sure you get a lot of messages from people who know you since your undergrad days. Your transition from those days to now, I mean, it's remarkable and
as I said,
it's
just needed the right environment, the right people to bring out what was there that I didn't know was there.
Right.
And basically make me love what I do, which I never thought I would have loved. So it goes down to that, that's pretty much it. I think it can happen to everyone. You just need to find the right place for it to do it for you. And as I said, I think Kings needed me as well, because that pushed their fucking boundaries too.
The last one. If you were not a dentist, what would you be?
Oh, I love the liquor industry. I love my alcohol. So I would definitely be working as a barman or something to do with alcohol, man. So I did.
That's an interesting answer. Yeah.
I did work behind the bar as well quite a bit with some great people. I used to travel to Italy for that on the weekends. I mean, not every weekend, but maybe quite often. But I think if it was not dentistry, I would have definitely been doing something with alcohol, because I love it and I love serving it. So
Amazing. Before we leave, I forgot to ask you one topic, which is like a raging topic right now, is bioceramic sealers. What's your take on that?
Firstly, the terminology is not bioceramics. Okay. We should be calling them hydraulic calcium silicate sealers or cements. Because bioceramic is a very vague term. That's pretty much your pot in the bathroom or the sink. What we are using for outcomes is the calcium silicate part of it. So we should be using the biological and scientific name, chemical and scientific name, rather than a generic one. And that is not my take. That is the person who's done the maximum amount of research about it. She says that, and I completely agree with it. Going into what's my take? I think they're good. I use them. But is it any better than our regular conventional AH+, say with warm vertical condensation? Evidence suggests that they're comparable. Okay. So I wouldn't say one is better than the other. But again, keeping in mind that if you're doing AH+ with a single cone, that is not the gold standard. So if you want to compare sealers, we have to compare obturation technique as well. We need more long-term evidence, bigger cohort studies and randomized control trials to differentiate one from the other. I am using them. I keep switching as well, depending on when I fancy using warm vertical with AH+. But I think they're good. My worry with calcium silicate sealers being so readily available is, number one, the marketing gimmick by so many companies that are just selling them bioceramic sealers. They don't really tell you the components of what is there in it. Is there calcium silicate sealer? Is it calcium aluminate? So I think that is one thing that people are just buying into the gimmick of it. Number two is people using these sealers without a rubber dam. Because eventually if they fail, they will have to get retreated, and retreating them is very difficult. So if you're doing it, you do it correctly. Outcome studies at this point show they're good. But again, stick to your principles and keep it simple, because I wouldn't say one is better than the other. It's good. They're comparable, but what you're comparing it to should be correct, which is a warm vertical condensation with either your epoxy resin sealer or your zinc oxide eugenol sealer, or your calcium silicate that you're using with a single cone technique. But you should compare them to the right ways of obturation.
Understood.
And don't get caught up by the market of what they're selling. You need to know what you're buying.
Okay. That's about it.
Perfect.
Dr. Shaurya, thank
That
you so
was
much.
great. No doctor, we spoke about that already.
Yeah.
Just first name basis, please.
Thank you, Shaurya, for taking out time from your. I mean,
I told you I'm unemployed right now. So
for now, but then we spoke about a lot of different topics, and I'm sure we have a lot of different topics to speak on. And you have a vast experience of, we have skipped a lot of topics, which hopefully we'll keep it for another podcast, and would love to again have you again on it soon.
hopefully, man. And next time we'll get a pint as well. Now.
Absolutely.
We got
my Red Bull.
You don't drink? Oh, bloody hell. Come on. Okay.
And I've it. So thank you for also your podcast. So again.
Oh, yeah. It's something that I've been thinking of for very long. Designed my logo as well, called Endo with a Pint. It's basically talking unfiltered endo as we would at the pub.
Yeah.
Because that's also a place where I learned a lot.
Yeah.
We call it the irrigation seminar room. Because we go there and that's where we learn a lot.
No, we'll wait for that announcement soon.
Yes. So, it's something that I've been pushing aside, but I need to do it.
Yeah.
And
We'll wait for that.
Getting some good fun people for that as well.
Done. Definitely. So thank you so much.
Thank you so
It was
much.
lovely
brother.
talking to you.
Thank you so much.
We'll again have you soon.
Cheers,
Thank you.
mate.
Thank you.
Should we do the burden thing?
Let's finish that and then. Okay.
How are you? Was that okay?
Perfect.
Was good?
Yeah.
Covered a lot.
Of course.